welcome to the Hollyoak Medical School podcast. Today we'll be talking about the Medicine with a Gateway Year programme. My name is Ellis and I'm a third year medical student and I was part of the first cohort of the Gateway Year. We're joined by some other students who have been part of the Gateway programme. If you'd like to introduce yourself.
Yeah. Hi, my name's Isabel Marshall and I'm a second year medical student and I was on the second cohort of Medicine with a Gateway Year.
Hi, my name is Mohammed and I'm currently doing Gateway.
And we're also joined by Dr. Anna Hammond, if you'd like to introduce yourself, Anna.
Hello, I'm Dr. Anna Hammond. I'm the Deputy Director of the MBBS programme. I'm involved with communication skills teaching and also I have students with me because I work as a GP for part of the week.
Fantastic. So starting off, briefly, how would you describe the Gateway Year? What is it? Isabel, if you'd like to.
I would describe the Gateway Year as, in simple terms, a trial run of year one. I think that's a really good way to describe it. It's a foundation year, it gives you an extra year to prepare ready for the medicine programme. And everything that we covered over the Gateway Year, I felt like going into year one, it made me much more prepared because we'd already had a go at it. We'd already had kind of one attempt at trying to get it right so that when we went into year one, we were more prepared. We knew how the medical school ran, we knew how the course ran, so we were prepared for the year one to begin. So yeah, that's how to describe it.
Similar to Isabel, like it's like a stepping stone between A-levels and med school. Like there's so many differences in learning and like having a specification, you need to learn this and that. In med school, the subjects you learn are different and the way of learning is different. So like having this will transition the move from A-levels to first year. Obviously haven't done first year yet, but I feel like this is going to be the case.
Yeah, and I would say from my perspective, that's the joy, is seeing students then start year one with confidence and saying that actually they find it so much easier to work in groups and interview patients from the experience than if they'd come straight from A-levels.
It is, it's a head start. That's why it feels like you've got a head start on year one. So when you come in and you do meet everyone else who's joining as a first year, you've already got that year behind you of practicing everything that you're going to kind of learn again. So yeah, it is a really good head start and it made year one much easier, I would say, as well.
Yeah, I think it definitely reduces some of the burden, especially around things like clinical skills. Covering things like clinical skills in the Gateway Year can often reduce a bit of the burden in first year when you're trying to prepare for exams and sort of things, because you've already covered that in the past.
Yeah, so when you look back with your perspective now as a third year and look back on the Gateway, what do you reflect back now?
I think sort of it makes you a lot more confident in talking to patients because I've had sort of that extra year of speaking with patients. And in terms of the examination skills and examination findings, as you know, sort of phase 3, year 3 onwards is about putting those findings with sort of diagnoses and figuring out what's wrong with people. So I think being able to have experience of mastering the skills of finding out how to do that really helps as you sort of progress along the course in sort of phase 2 and phase 3.
And I think any experience as well of being able to speak to students, as you get further through the course, you realise how valuable it is being on placement and speaking to patients in the GP and in the hospital setting. And the Gateway Year gives you an extra year of doing that. So when you are coming to speak to patients in the hospital or in the GP setting, you've got so much extra practice behind you that you tend to not worry about what you're saying or what questions you should be asking, and you're listening more to what the patient's saying because you can relax a bit more because you know that you do have a good idea of what you're doing, you do know what you're doing, and you can then start to focus on the findings, which then helps you with kind of working out what's going on.
Even with the biology side, like thinking back to the start of the year, the amount of knowledge I have learned in Gateway is very, very large. Like imagining myself going straight from A-level into first year and from Gateway to first year with all that extra knowledge, like embryology, radiology, pharmacology, subjects you do not cover at school. Like I have that academic content head start as well. So with the clinical and the lecture-wise content as well, it really helps.
It does.
So speaking about sort of bridging between school and sort of medical school, university type education, what's your guys' background? So why did you apply for the Gateway programme? Why did you come to medical school?
So I actually applied to medicine the first year as I was coming out of sixth form, and I missed my grades in chemistry. And then when I reapplied, I could only reapply for the gateway year, and it didn't bother me at all. I was so happy to be coming when I got on the results day when it said, "Yep, you're going to medicine with a gateway year." I was thrilled. Just getting into medicine is a massive thing. And the gateway year, coming out of school, I knew I was ready to go to university and study medicine, but I was worried about the leap, like you've mentioned, the leap from sixth form and college to university. It's a big jump, especially in medicine. There's so much that you're learning that you've never covered before. So yeah, coming out, I was glad that I got onto the gateway year course and had that extra year of preparation.
So for me, I was meant to be doing my GCSEs when the pandemic hit, so I never had the exam practice. And then going into AS and A-level, I had some doubts that I wouldn't get the grades. And then after I really, really thoroughly researched medicine and Holyoke, especially because it's quite local to where I'm from. So like I found out about Gateway. It has lower grade requirements, and like seeing the benefits it has in the gap, I thought it'd be safer to apply to Gateway so I can secure a place.
Yeah, I think I was quite similar to you in my chemistry at A-level. I wasn't probably excelling as much as sort of the typical requirements to get into medicine. I was also sort of a first generation university student, grew up locally. Not many people from my school were sort of applying to medicine. And I was quite fortunate in that when I was applying to medicine, the gateway year was just being introduced. So it was sort of, I felt quite lucky that something was being introduced in my area where I lived and gave me the ability to go on and study medicine with maybe not having got the grades that I maybe needed to do the 5-year program. But yeah, as you guys mentioned, you know, getting into medicine, it's a big achievement. And, you know, I think it does sometimes seem a bit unfair if you drop 1 grade, that necessarily doesn't mean you're going to be sort of a bad medical student or a poor doctor. I think it's sort of a fantastic opportunity that the medical school has introduced, especially to, you know, as you guys know, we've probably got a shortage of doctors in the UK and the area. So I think that is part of why the school introduced the programme. And that moves on to the next question, which is probably aimed at you, Anna. So why do we offer it as a school and why do we value it?
Well, I think as a GP, my goodness, we absolutely need more doctors, don't we? Definitely. The Hull York Medical School course has been here for a long time, and we know that we train exceptional doctors who are really good communicators, good thinkers and PBL. But you're exactly right that there are some students who miss a grade or go to a school where they don't have as much support and don't achieve the grades, but that doesn't mean that they've got the skills, that they haven't got the skills to come and be a fantastic doctor. And I've had students with me in practice and their thinking is just excellent. So, you know, it's not a predictor. And we're delighted, absolutely delighted to have Gateway students like you benefiting from the Gateway programme and then coming into medicine. Because it's a big transition for anybody, isn't it? From A-level to medical school. It is a really big transition.
I think what's mentioned, that we've all mentioned there, is that we're all local students.
Yeah.
We are all local to the area.
Yeah.
And as we know, so I'm guessing we're all local to Hull, it does have a really high level of deprivation around here. But I think with local students especially, we've chosen to train here and we want to work here after. Because this is where we're from and things like that. So I think the Gateway is nice that it brings in those local students who have knowledge of the area and want to train here and want to improve the area here, which I know Hull York Medical School is all the pathways programs that the medical school offers and everything preparing for medicine, it is about getting students from this area into medicine and studying medicine, and it works clearly because we're all local students and we're all here studying medicine.
And we hope you're going to stay in this area and be doctors, so definitely.
So we've already spoke about how Gateway prepares you for the 5-year programme. In terms of some of the specifics, do we do sort of clinical and communication skills, and why do you guys think this is important to do?
So I'm currently in Gateway, and yes, every week we have clinical skills sessions. So we learn an add-on to one of the most important skills you're going to need as a doctor, which is history taking. We do that a lot, like each time add on more to it and practice it. We have simulated patients come in who are actors that the Hull York Medical School brings. So we practice taking a history from them. And then once we go on hospital placement, we actually take a history from a real patient. And it's not just the history taking. We also learn how to perform physical examinations. Last week I had my mock OSCE, and that had physical examinations as well. It went well.
Good.
So, yeah.
So by the time you come to the OSCEs in year 1 and year 2, you'll be a pro, won't you?
Hopefully, yeah.
Yeah. And I think what you said about the simulated patients is really interesting, because they are trained to come and then they can simulate a scenario, but they're also really highly trained to give you feedback on your skills, and you learn to reflect on your skills. So by the time you arrive at the beginning of year 1, you've had all that experience ahead of the other students, so that then you can fly as you go through years 1 and 2.
And I don't think it was until I joined first year with everyone else, I still remember in the first week of clinical skills, we were to take a history from an SP, a simulated patient, and within my group, obviously no one had ever done that before, and I sat down and I took a full history from a patient, and I was like, I cannot believe how much we've learned and how much we actually know. When it was strange. I just remember thinking, this is strange that I've learned all this, and you don't think about it too much. You kind of, yep, this is a simulated patient, or yep, this is a patient in a hospital, I'm going to ask you some questions. But you do learn, like as you mentioned, you add things on, you learn the full structure, and then throughout year 1 and year 2, you then just kind of make it better. Make sure that you're asking the appropriate questions to get all the information. Then year 2, you're getting a bit more into the specifics. But I just remember that first week of being in first year thinking, it's crazy how much I've learned and how much I know coming into this with everyone else kind of at the beginning of their journey.
Which will be you in September, October.
Yes,
Yeah.
hopefully.
Yeah.
There is a common saying, isn't there, that the patient is your best teacher. You can read so many books, go to so many lectures, but I think sort of from a year 3 perspective, being on full-time clinical placement, that you do learn the most from your patients, whether that be something that they've told you, or you found on an examination, or you've seen in theatre perhaps. The best way to learn is to speak to patients. And I think that's how you definitely maximise your learning. And going back to, as you mentioned, the simulated patients, they are fantastic in terms of setting you up for clinical placement. Sometimes you think they are real patients, given how good they are. But I think the concept of OSCEs and clinical skills when you first come to medical school can be quite daunting, because it's, as we mentioned, it's a new concept. But I think having that early exposure along the line, sort of year 2, year 3, and so on, I think you become a lot more confident. I think if you ask the majority of people in my year group which exam they're least worried about, it's probably the OSCE, because we've had so much exposure to it, and you can sort of predict or have an idea of what you're expected to do. But yeah, I think that early exposure really, provides you with a background of knowledge, should I say, to sort of what you need to do in those clinical environments. I think it is what we signed up to medicine to do, the clinical side of things. People don't sign up to medicine to, obviously reading books and going to lectures is part of it, but the main reason you want to do medicine is to do clinical skills, to do hands-on stuff, to speak to patients. So doing all that stuff early on is quite exciting, I think.
And there are still those students who do go and just hide in the library and who don't realise what you've just articulated, which is that you've got to clerk and take histories from lots and lots and lots and lots of patients, and that's how you develop your skills. That's how you hear how patients present with heart attacks or strokes or appendicitis. So yeah, the Gateway obviously makes you realise that early on, which then impacts how you learn as you go forward through those 5 years.
And I think as well, you mentioned you learn from like hearing what the patient says. Yes. For me as well, prior to coming to medical school, doing A-level examinations, I did find them more, your exams, I did find them more challenging, because that's not my preferred style of learning. My preferred style of learning is practical. So coming to medical school, yes, I still have to do that academic learning, but having that practical side helps me apply it and understand it. And without seeing it, I struggle to understand it. So having that earlier and more practice of that, it's really helped me learn kind of the things I need to, that I wouldn't have been able to if it was just lectures and seminar, things like that.
And I think also PBL and the clinical skills helps you learn, and then I think it also helps you remember later on, which is really helpful. You then remember that information.
So I know we've touched on sort of the clinical skills side, but do you guys do clinical placement in the Gateway year?
Yes. So for this year, it has been once every other week. We go to Hull Royal, and once we've been to Castle Hill Hospital. So the first half of the year, I'd say it was mostly taking histories, because that was the only skill we were working on. And then as we started to learn how to perform physical examinations, so we would go with a clinical teaching fellow who's a doctor, like training and helping medical students. We take history and then perform physical examination on real patients. Like you're wearing scrubs, you've got a stethoscope around your neck. It is a great feeling, and you really learn a lot, because that's how in real life conditions are presented.
Yes. And I think you're describing there, it's to do with developing your professional identity, isn't it? Because it's quite a big step when you first wear your scrubs and you have your stethoscope and you have to introduce yourself to a patient and examining them. And it sounds like you're developing your professional identity through the Gateway as you then come into year one.
Mm-hmm. And I think the placement's no different in Gateway year 2 it is, say, in year 1. I can hands down say, after I've been at medical school for the last 4 years, that my GP placement in Gateway year was the best placement I've had, and I learned the most on. So for anyone who thinks that maybe placement's not as hands-on or interactive as on the 5-year programme, I think that's definitely a misconception. Because I was at a GP in Barton, and it was a fantastic place to learn.
Me too.
Yeah,
it was
really
a good GP.
really
and do you know what, with the GP as well in the Gateway year, because there's less of you, there was only 30 in our cohort, so it's a really small number. So we were in really small groups, which actually I felt like we got so much teaching because there were less of us. And the tutors really got to know us as well, because there was less students, so that they could get to know you better. So on our placements, I do feel like we were so hands-on and we learnt so much because there was fewer of you and you were in smaller groups. It was really enjoyable. I really liked it.
Mm-hmm. And Anna, from a sort of teaching point of view, what would you say the benefits of small group teaching are as opposed to, as Isabel's mentioned?
Yeah, and I think there's something, isn't there, about students when they've come out of A-levels, and it's that nurturing them through over a year that you get to know them and you see them develop, so it's hugely rewarding. And I think it's a bit like the analogy of a chicken and nest, isn't it? You want them ready to fly into the programme, and that's really enjoyable for tutors. And getting to know them in small groups, seeing people through the year is really helpful. And I'm sure you've got to know the teaching fellows that you've then seen in a hospital setting as well.
Yes, like you have more time to speak to them. One of the clinical teaching fellows has taken a year or two out of her cardiothoracic surgery training. Like if you have high aspirations, and even if you're just a curious person like myself, you get to know them as a person, and you get to know like medicine down the line, what it's like training and specializing as well. So there's that benefit to add on.
Yeah, so there's something, isn't there, about being a role model, that actually you've then got role models who are clinicians who you've come across on placement in the Gateway, which that's inspiring, isn't it? We all like role models as we go through. I was just thinking how amazing that in a few years' time you might be the role models for students who are just coming in on the Gateway year.
Well, I was just thinking, my clinical teaching fellow this year is an ex-HIMSS student, and it is so nice because she's like, right, what's coming up? What have you got? Like, what exams are coming up? And she can relate and talk about, I remember that when I was in second year. And it's nice to have someone who's been to the Hull York Medical School then teaching you and knowing kind of where you're at, what you're going through, what you learn about. It was really nice to have someone that was from here as my tutor this year. I've absolutely loved it.
Yeah, I think the delivery of medical education is sort of shifting now from the traditional model of a good example, sort of being in surgery and getting grilled by a surgeon on a certain piece of anatomy to whereas now it's a much more holistic approach. People understand sort of what it is you're learning, and are more than happy to tailor their teaching to your needs, which I think is really good. So how did you guys find the transition from Gateway into year one?
So nice. I thought year one was so much less stressful than I expected it to be because we'd already had a year of practicing things. As I said before, I feel like the Gateway year is a head start for year one. So it takes a lot of that pressure away because you know how exams are run, you know how your skills is run, you know how they organise placements. You've had that experience of everything. So going into year one felt so seamless and smooth, and I didn't have to worry. I wasn't panicking about anything. Starting university is scary, but you don't have that because you're here. You know the building, you know the staff. So definitely felt really kind of smooth going from Gateway into year one for me.
And how do you feel about to finish Gateway and then go into year one?
So we mentioned it is Gateway is a head start, and it is like, for example, with anatomy, being exposed to a cadaver for the first time. For a lot of people, it's a shock. But now, when I walk into the anatomy lab next year, like, this is fine. I've had the experience, and the exposure, and I'm confident I should be confident with anatomy. I am now, so I should be confident next year. But also with the biology, with the clinical skills, having that year of confidence, like, I feel easy about going into next year.
I think it's even the small things like you've already got your friendship groups formed.
Yes.
That's sort of I wouldn't say a burden, but it's one less thing you've got to worry about. When you do hit the ground in year one, you've already made friendships with people over the Gateway. I know when I started, there was only 22 of us, so we were a really close-knit group, and some of us still live together.
I was going to ask you that. Were you still in touch?
Yeah, definitely. Yeah, a lot of us are paired together on placement and hope to be sort of in the coming years. So yeah, it is nice, and it's something that follows through the years. Just touching back to the content of the Gateway year, speaking about medical scholarship, can you guys tell me a bit about that? Because it wasn't called medical scholarship when I was part of the Gateway. I think it was study skills.
So you do cover a lot of, like, a wide range of topics in medical scholarship, ranging from study skills, academic writing, looking after yourself, mental health, because medicine is tough, arguably the toughest course. So you really need to be actively taking care of yourself. And in Gateway we have a few essays, academic essays. If you've not done an EPQ in A level, like, none of us had academic writing experience before. So it teaches you the skills that you need to, do well on assignments in medical school, and how to go successfully throughout the Gateway and the 5 years as well.
Yeah, and like you said there, you learn how the study skills. Prior to coming to medical school, you don't know how to write an academic essay properly, you don't know how to reference properly.
Yeah.
And so they take the time to teach you those things, and you do have quite a few essays in the Gateway year.
Yeah.
So they're like your practice runs at getting those skills right, which then when you come into kind of your first year onwards, we have SSIP, the Scholarship and Special Interest Programme, where you have to write a long essay for it. And again, it takes some of that pressure off because you've had that practice and that feedback on how you've written an academic essay, if you've structured it well, if your referencing's correct. And I remember when I was writing my first year essay, I went back to some of the lecture slides that I had in the Gateway folders and went through them, because they give you those tools there that can then help you in future. So I remember writing that essay, and even again this year, it takes some of the pressure off because you know that you are on the right track and you've got the right skills. You are still taught them in year one, but it was nice the year one was just like a refresher, whereas in the Gateway year, they really took time to teach you how to do those skills.
Mm-hmm.
Yeah, and I think it's less daunting, isn't it? When I see students who are struggling, it's often because they're struggling to get their head in the first 2 years into how to learn, and you've got the advantage from the Gateway in that you've already prepared that ahead of the then learning how to learn in year one.
Yes.
I think even just the small skills like referencing an essay, I think going back to, as you mentioned at A level, if you do exam-based subjects, you're never really going to have to cover things like referencing. So it is a new concept, which can be quite daunting. I think it is still quite daunting for a few of us. But it is something that sticks with you, not just in medical school, but throughout your career. Things like critical appraisal, which you do in year 2, as you mentioned, SSIP, and sort of going onwards, research and publications and things like that. Things like referencing and certain study skills like time management are really important.
And I think that, medicine is hard, isn't it? And you're talking about how in the Gateway there's quite a bit of focus about resilience and about mental health and study skills and how you're organising yourself. Those skills stay with you for life through medicine. That's powerful, definitely.
Mm-hmm. That's all the questions, guys. Thank you for your time and talking about your experiences. I think sort of your input's been really crucial to potential applicants in the future. So thank you for listening to this podcast on Medicine with a Gateway Year. We hope you found it useful. To hear more episodes, please visit the Hull York Medical School website. Thanks again for listening. Bye-bye.